different. Okay. Dear friends, I am so happy to meet you on this Saturday because this is a very good day. We did 2 cases of Puberphonia today. Now the number is 1093 patient we have completed. Today is 1st April 2023. So every day we are seeing the patient and getting their report, and every day our idea about the treatment of Puberphonia, what we have to tell the population, the friends, common people. We are getting rich knowledge because two or three good happened today. Today, one of my good friend, Professor Dr. R.C. Dekha from Delhi, he noted my number today only after a gap of some 30 years. He called me and congratulated me for the work we are doing in Puberphonia. He told me it is a very excellent work you are doing. As an elder man, elder doctor, you are telling it will be a great learning and initiation for younger generation that you are doing research on Puberphonia. That too, you have completed more than 1093 cases of Puberphonia. It is a history. It is a record break. So R.C. Dekha of Delhi, he was the ENT professor of All India Institute, Delhi, AIMS. He was a director also. I know him when he was there in Pondicherry as ENT professor. He was the professor of ENT in Pondicherry. That is also a central government institution, AIMS. So from there he went to Delhi. We worked, actually I worked as an examiner in MBBS and MS in Pondicherry also. Then I also worked as a invited, not only speaker, a demonstrator for ear surgery. That time I was very popular with my work, vascular myringoplasty, for which I got the national award. That time I also did another research called as a labyrinthine transplant in rabbits, inner ear transplant. I tried to transplant the hair cells from one rabbit to another. So that also I have done 2 researches. And I had a original paper on how to enter into the middle ear. What is the anatomical study, how we can do a new approach to the middle ear also. This is very much fascinated. And then the head of the department of EAT of AIMS Delhi was Dr. Kakkar, Dr. Sandoz Kakkar. He is helping me in giving a lot of encouragement regarding my work. He had invited me to Delhi to do a workshop on tibonoplasty. I did. I was a invited faculty for Delhi AIMS to do tympanoplasty, because that time I was very popular in doing vascular myringoplasty. For that, I got a EMERC award by the Indian Society of Otorhinolaryngology. So AOI had given me the that year recognition for me for my work, phenomenal work. And this labyrinth transplant also, I got a national award by the that time. Dr. Kakkar was the president of Pediatric ENT Association of India, and he had awarded me with a gold medal or number one first prize for the research work done on rabbit labyrinth transplants. So RC Decca had given me a great applause for my research work. Following that, I had a talk with ex-Vice Chancellor of Tamil Nadu, Dr. MGR University, Dr. Mairi Vakanan, and he told me we'll try to organize a meeting in your place. I will come. So he had told me. And then another friend of mine had come today to my clinic, and I had a small discussion with him. That is Munaivar Ravi Tamilvanan. And he knows that I am interested in doing puberphonia. He had seen 4 patients undergoing the training in my hospital, and 2 patients are waiting, because today, 1st April, we did 2 cases of puberphonia. The 2 cases were waiting, and he had seen among them one. He had a recommendation letter from his own college. So we are doing it completely free for that boy. So he was very much excited that we are doing freely also. Yes, yes. Every day, every week, some patients are coming for puberphonia treatment. We are doing freely, but we are insisting that you should be useful to the society in eradicating the puberphonia. We are willing to do puberphonia freely, but you should be a media person to tell other puberphonia boys that we are treating it without any surgery or medicine in 5 days. So one medical student already we have done, a lot of students we have done freely. Last week we have done one medical student from Tahur Medical College freely. Now this boy is from Arts College, so we will do freely. There's no hidden charges or anything, nothing doing. We are doing freely because these boys were willing to spread the knowledge of puberphonia, that it is curable, no operation needed, only 5 days training, it will be all right. So they will be the ambassadors. So on seeing that, Mr. Ravi Tamilvanan, he congratulated me and told, this Kichikural Nivaranam, it is not yet treatment for you, but you are a Samuha Prachanakku Thirvu. You are doing a Thirvu for Samuha Prachanai. Then he was telling his mind that how some boys are acting as passive agents for senior boys, and how their life goes as a homosexual individual. We have a lot of experience, and we are doing so much of work on that also. So three people, we had a great uh, respect and words. So our work on puberphonia, it is going in a great and appreciable manner. So now, as I have already told, even the British people, some doctors are using, uh, they are praising, some people are even telling, are you confused with the head voice or chest voice or throaty voice? This is what some um, British ENT surgeons are inquiring about me, because they are all having the feeling the puberphonia voice, they are having a separate voice quality. But we are insisting that they may have 10 type of voice in puberphonia. Yes, even double voice, in child voice, female voice. But the origin of the voice is how puberphonia voice develop in these uh, puberphonia voice mean they are having the persistence of their child voice. That's all. Child voice continue after adulthood. So they continue to speak as a child. And child voice, everybody knows, child, the age of beginning first year to until maturity, it may be 14th year or 15th year, both boys and girls will have female voice only. That everybody should understand. For male, the voice break. If the voice is not had the chance to break, that may have the original childish voice, or what the voice will do, they try to modify the voice, modify the pitch as they like. That is the thing. So, what are the modifications they are doing? That is the great thing we are intended today. That is head voice, throat voice, or chest voice. So, that is the thing. So, this had a great influence on your speech. But Tamil consonant already they have told kasada dabara ngengene namana yarala valala. The origin of these words may be a throat voice or head voice or nasal voice. That itself scientifically you can prove. So that will give a nice idea how the puberphonia can be treated also. So that is why the puberphonia treatment is also available. Olden days itself, or commonly they are doing treatment for puberphonia. So the puberphonia is not a new one. Many are doing treatment, and everybody knows puberphonia voice is a hidden phenomenon in all puberphonic voice, the normal voice. And they will get the voice when they cough. So when a puberphonia patient cough, the frequency changes. So that frequency they are utilizing for a direct voice therapy. All over the world, puberphonia is treated by the speech therapists, but it will take long time. We are not denying that we are not the only person treating puberphonia. It is treated by speech therapists. Speech therapists are doing the therapy for number one method is direct voice therapy. Second, so direct voice therapy is also there. Second thing is indirect voice therapy. Third thing is audio visual feedback, and fourth is surgery. So these four type of treatment is already existing and they are trying, but they will get the voice, but it may take long time. In our experience, we have already found out puberphonia boys will come and ask us, what is the type of voice I will get after treatment from you? Very clearly we will tell you will get your ancestral voice. Your voice won't be damaged, no damaging of the voice. Why? Because we are not doing any surgery on the vocal cord or vocal tract. We are only manipulating the uvula, that's all. That too, the auxiliary organ for speech. So when there is no operation, no medicine, no injection, we are not doing any surgical manipulation of the vocal tract. So what is the voice you will get after our therapy? That's called UMR. Uvula manipulation and resonance is they will get their own ancestor voice. So this needs direct voice therapy. Direct voice therapy is in the form of vocal exercise. As I have already told you, even coughing will produce a normal voice in puberphonic voice. If you want to get the voice, you press the Adam's apple and cough. So they will get the voice. So they have all ENT surgeons are having the feeling coughing is producing normal male voice in puberphonic voice. Just press the Adam's apple. You will get the normal voice with cough. The mechanism is the shortening of the vocal fold, which is a physiological phenomenon to reduce the pitch. So that only created an idea for ENT surgeon. Those who are puberphonic, you press the Adam's apple, thereby the shortening of the vocal cord comes. Patient is having cough and normal voice. So why not cut short the vocal cord and get the male voice? So many people are trying. It may be good in their hand, but in my hand I have tried, and it is almost failure only, because it may look so impressive and would give good result anatomically. You are shortening the length of the vocal cord, but unnecessarily the structure of the vocal cord is disturbed by the surgery, and we don't know what are the contraction happen in the post-operative period even 1 week, 1 month, or 1 year. They may have contraction of the or structural change, fibrosis of the vocal cord, thereby their voice may have a defective. It may be defective in pitch or their pronunciation. So this is what going to happen. Then there are other vocal exercises available to treat puberphonia um, by masking, vocal exercise, glottal attack before the vowel, effect with the effective closure technique, and laryngeal muscular relaxation techniques. And few cases you can lower the larynx to approximate. See, this is what originally thought by all the people. What happened with the vocal larynx in gentleman, the larynx descends. Male, the larynx descends. So that is the problem created by the structural changes. So why not we operate and change the position of the larynx? If larynx is a little elevated, the puberphonic voice may disappear. So lowering the larynx to approximate position, it can be done with the hands by the patient by putting pressure in the Adam's apple and lowering the larynx. The vocal cord relax and the pitch may be lower. So this exercise can be done. And another thing also, you can do humming exercise. Humming exercise also definitely will help to change the pitch. And with swallow, if you talk, that also changes the pitch of the voice. So these are the things they say as direct voice therapy. Then there is a indirect voice therapy is also available. So indirect voice therapy is more effective. It means you do counseling, do a psychological or a lesson or training, help to identify the puberphonic voice. What is the psychological factor that contribute to this disorder? And you try to correct the factor. Because many patients will put forward the reason for their puberphonic voice. Maybe they had some temperature or something like that. They may tell like that. So that is the indirect voice therapy, counseling. The next one is audio visual feedback. That also can be done. Audio visual feedback allows the patient to observe graphic and numerical representation of their voice and pitch. This audio visual factor allows the patient to determine an idea or ideal pitch range based on their normotensive data, their age, and their gender. As the patient improves, you can make it as a habit. So this is also, many people are trained, but it will take long time. So far this is what done. So the But one is they are even doing medical treatment, because medical treatment means, is it due to a reflex factor, esophageal reflex, GRD, or any other sinusitis or post-nasal drip, which is a cause for it. They are taking to change with medicines. Last one option is surgical one. So, in case when traditional voice therapy is ineffective, surgical intervention is considered. But in my surgical we have done, and it is not successful at all. There are different type of surgical approaches for this puberphonia. The first surgical treatment developed is relaxation thyroplasty. That is called relaxation thyroplasty, which involves the bilateral excision of the 2 to 3 millimeter of the vertical strip of the thyroid cartilages, which lower the vocal pitch through the anteroposterior relaxation and shortening of the vocal cord. This can be done under local or general anesthesia. Then another relaxation thyroplasty, which also lower the pitch by creating an incision bilaterally in the thyroid lamina and then depressing the anterior segment of the cartilage. Now, more recently, they are doing window relaxation thyroplasty. This approach involves creating a window in the anterior commissure, which is then displaced posteriorly. Okay. Now we are not doing any surgical maneuver because we are able to prove until today we have treated cases of puberphonic voice with unilateral vocal cord paralysis and paresis. In case of thyroid surgery, in case of hemiplegia, a brain injury, we are able to get their normal voice with their vocal cord, unilateral vocal cord paralysis. We have evidence. We have recorded the case and presented the case also. So this had given a new idea for us that vocal cord, only you should have a vocal cord to vibrate and come closer to make a sound, that all. So a sound is there. If a sound is there, automatically it can be resonated at the end of the mouth or nose. So there is no difficulty at all. So vocal cord level, voice is not created, voice is generated. So in vocal cord unilateral paralysis, definitely the patient will have a puberphonic voice only. We have seen brain damage, hemiplegia, thyroid surgery. We got a normal voice for a male. And in female also we have tried, they have got also the normal voice. So what is that mechanism is simply we can say that treatment is ask the patient, do manipulation and try to bring the speech from the abdomen, they will have a good closure of the rhyme of glottis, that is the gap between the vocal cord. So, how a good generated noise there, and you can use your respiratory tract and get the normal voice in puberphonia with vocal cord paralysis and paresis. This is a great achievement. But as a scientifically, you can ask, is it why the patient after paralysis they are not getting the voice? Only after your manipulation, you are telling they are getting the correct voice, even though they are having the vocal cord paralysis. Why it is like that? When they are having vocal cord paralysis, even without your manipulation, they should get the voice. You are not doing any surgical manipulation to get the voice. You are only doing a manipulation and utilizing the closure of the vocal cord gap with the paralysis, because one vocal cord is moving well, so they will be able to talk well. Why without your procedure with the paralysis they are not able to close it? This is very simple explanation is there. See, you know it very well. You can catch rat in a cage. Okay. So we are able to catch rats in a wooden cage only. But we know that many wooden doors and windows, the rat can make holes by biting and make hole in the wooden doors and window, and they can escape to the other side. So everybody knows that. But in a cage, when you are catching it, the rat, why it is not trying to make a hole on the wooden cage? That is the psychological feeling. You feel you have caught inside, you cannot escape. See, rat can escape from the cage by biting and making a hole in the wooden cage. But it is not trying to come out. But the ordinary doors and window, it can make hole and go to the other side. So the same phenomenon, vocal cord paralysis means is only a puberphonic voice. So with that, so this is very clear. We will be able to have and give good voice in patient with the paralysis, vocal cord gap, and keyholes in the vocal cord or bowing of the vocal cord. We can give good result by our treatment that is called treatment for puberphonia. I will try to meet you next Saturday from 5 to 5:30. Very excited talk will be there next Saturday 5 to 5:30, because most of the patient, we are mostly 50% of the patient with the puberphonia, they are homosex, means they both is attracted with same boy sex. But puberphonia boys, no, as if they are female. So very interesting topic. I know next week onwards we are going to enter into the sexuality of Puberphonia boys. Hope to see you next Saturday. Thank you very much. Great, happy